The investigation into how these cases came into our community. Yesterday, we confirmed we are dealing with the infectious Delta variant and that it came from Australia via the New South Wales outbreak. I can now report from the whole genome sequence analysis that our current positive cases are a close match to a recent returnee from Sydney who arrived on a managed red zone flight on August 7th, had a day 1 test on the 8th, returning a positive result on the 9th. They were transferred from the Crown Plaza to the Jet Park quarantine facility that same day. This person subsequently became unwell and was moved to Middlemore Hospital on the 16th of August. What this information tells us is that our cases are most likely to have come from the traveller. This is a significant development. It means now we can be fairly certain how and when the virus entered the country, and that based on timelines, there are minimal, possibly only 1 or maybe 2 missing links between this returnee and cases in our current outbreak. And the period in which cases were in the community is relatively short. There is still a chance that additional information could emerge to change this conclusion, so we do need to remain open to other possibilities. That means you will see our public health unit continue to be very cautious around possible places of interest, and you will have seen that in some of those locations of interest to date. However, the balance of evidence now gives us enough confidence to focus our search for that missing link. Our primary lines of investigation are staff at the Crown Plaza Managed Isolation Facility where the returnee was originally based, staff at the Jet Park Quarantine Facility, and other MIQ and border staff involved in their arrival and transport from the airport and between managed isolation facilities. Middlemore Hospital is not a line of investigation at this stage, because the individual was only moved there on the 16th, 1 day before lockdown and days after symptom onset in a number of our other cases. So let's break down the possible points where contact with this traveller may have occurred. On the 9th of August, when the case returned a positive result, our public health unit kicked into gear, contacted Auckland Airport and Customs, who went through all the footage to determine any contact that positive case may have had with staff. This is our usual practice when we have a positive case in a facility. 3 areas of interest were identified. Customs confirmed with me again today that these have all been investigated and staff tested. Nothing has eventuated from this line of inquiry to date. Let's then turn to our facilities. There were 208 staff who worked at the Crown Plaza while the individual in question was there. Of those, as of today, only 1 of those 208 staff is now overdue for testing, and only by less than 48 hours. For the Jet Park, there were 200 staff working across the site from the 9th to the 16th of August. As of today, 2 are overdue tests, but again, by less than 48 hours as of today. All staff across both sites who have not been tested in the last 48 hours are now being retested. In terms of vaccinations, across both sites, 407 people were compliant with the vaccination order that we have in place. That order requires all existing staff to be fully vaccinated. If a new staff member comes on board, they must have their first dose and complete their second dose within a 35-day window. Only 4 had 1 dose and were not yet due for their second. 1 person had gone longer than 35 days, and that person has been told they cannot enter the facility until they comply with the order. All remaining were fully vaccinated. As you can see, the compliance generally across these sites has been really high, but we will continue our search in a thorough way across both sites, as you would expect. And we'll look to come back to you with detail on those additional tests we're running across both sites in future updates as those results come through. A final point. We have learned today that a family adjacent to the case at the Crowne Plaza has now tested positive for COVID on their day 12 test. While we're awaiting genome sequencing, we can assume that means we're dealing with a high level of infectivity in this case. Everyone at the Crowne Plaza will stay on while we undertake our usual protocols. But here is where our practice of what we call cohorting is really helpful. People generally arrive at the same time and stay for the same period in the facility. It really does reduce down the risks and means that we catch situations exactly like this one. So while today you will see we continue to find cases downstream, there could be relatively few cases upstream, as in people who picked up the virus from the very beginning of the chain. That's simply because it wasn't here for long, we believe, before it was found. On that note, can I thank again our first positive case that was identified on Tuesday. If it wasn't for you getting tested when you did, this could be a much, much more difficult situation. Having said that, I know we're all prepared for cases to get worse before they get better. That is always the pattern in these outbreaks. But today we believe we have uncovered the piece of the puzzle we were looking for, and that means our ability to circle the virus, lock it down, and stamp it out generally has greatly improved. I'll now pass to Dr. Bloomfield to go over today's case numbers.
Thank you, Prime Minister. Kia ora koutou katoa. So today I can report there are 11 new positive cases of COVID-19 in the community. That is since yesterday's 1 p.m. update, taking our total number of community cases all in Auckland to 21. All of these cases here in the community are being transferred safely to the Auckland Quarantine Facility or are already there under the usual strict infection prevention and control procedures. 12 of the 21 cases have already been confirmed as being part of the same Auckland cluster, and a further 8 are currently being investigated and are as yet not formally linked. However, for a number of those, there are strong leads to them being linked to existing cases. One of those previously reported cases of the 21 is confirmed to be unlikely to be linked to the cluster, and that is the air crew member you have heard me talk about in this morning's media round. So this is essentially a border-related case, probably coincidental, and that case was identified during routine surveillance testing. It's an international crew member. So whilst we don't have the details on the new community cases available at this stage and interviews are underway, we will release further information as it becomes available through the afternoon. Now, these new community cases are not unexpected, as the Prime Minister said, and we would expect the number of cases to continue to grow, in particular because of the large number of locations of interest and the mobility of these cases over the few days before the lockdown started. There are also 8 new cases in recent returnees in our managed isolation facilities. 2 of those are historical cases, and the information about those will be in the Ministry's press release. Now, 2 of our community cases were taken to North Shore Hospital overnight. One had worsening symptoms from their COVID, and the other is symptomatic and has underlying conditions. One of these people is in their 20s, the other is in their 40s. Both are in a stable condition. The Prime Minister mentioned the Crowne Plaza, and as a precautionary measure, a hold was put on some departures from the Crowne Plaza last night, and that was in response to this bubble of 3 people in the facility testing positive for COVID-19 at day 12 of their stay. This is something we do where we get an unexpected day 12 positive result, to just make sure that there's no potential that others may have been infected after they returned a negative day 12 test. So the returnees who are on the same floor who were scheduled to leave overnight are required to stay there while it's investigated further, and that has included already reviewing of CCTV footage and running the whole genome sequencing on these 3 new cases. That is due later today, and that will help us to confirm the probable link to the case in the room next door. This is, of course, disruptive for those who had planned to leave or were planning to leave, and they'll be provided with full support. Unless there are specific issues identified that might be cause for concern, it's likely returnees on other floors who are scheduled to leave today will be able to do so. The overall assessment is that for further transmission based on what we know so far is there's a low risk, but naturally we're not taking any chances. We've now received the results of wastewater collected on Monday and Tuesday this week. The sampling collected on Monday returned positive results for wastewater from 3 Auckland sites: Rosedale on Auckland's North Shore and the Western and Eastern interceptors. Sampling from Tuesday at the St George site in Auckland, and that's a sub-catchment of the Western interceptor, and that collects wastewater from the Waitakere area, was also positive. This follows negative results from these locations from samples on the 11th of August. I had one of my team just quickly map out the locations of the cases and how those sit with respect to those, the drainage areas for those different interceptors, and there are cases in all those areas that we know about now. So this shows given we've only got the 21 cases so far, the sensitivity of the testing is very high, and it does help us with our assessment of the situation. There will be further results available late today for some other samples taken around the Auckland region, and additional results expected tomorrow, including results of samples taken in several locations in Coromandel and Thames. Other sampling undertaken on Monday and Tuesday at Mount Maunganui, Tauranga, Hamilton, Rotorua, Gisborne, Taupo, New Plymouth, Napier, Porirua, Hutt Valley, Wellington, Nelson, Christchurch, Queenstown and Invercargill have all come back negative. On testing, in Auckland, all community testing centres are again open today with extended hours through to 8 p.m. There are 4 additional pop-up community testing centres open, and a further pop-up centre in East Auckland has been stood up this afternoon. I'm also aware that there is some additional pop-up testing going into Avondale College for students to be able to go through there and be tested in a safe way. There is increased testing capacity in Waikato, with a range of testing sites already in place, and pop-up testing sites remain open in Coromandel Township, Thames and Hamilton, and there was an excellent response from people in Coromandel yesterday with very high number of people tested. DHBs right around the motu are ensuring there is good access to testing. We need anyone with symptoms right around the country to get tested to help inform our advice to the government about alert levels. Yesterday there were close to 16,000 swabs taken across Auckland, the busiest day in that area since August last year. Around 10,000 of those tests were taken in general practice and urgent care clinics, and I want to thank our colleagues working in those settings who have really been very busy over this last day, their busiest day ever. Nearly 3,000 swabs taken across Waikato, and about 600 of those were from the Thames Coromandel area, a massive effort, and thank you very much. And I want to thank those who are for their testing and waiting for testing for their patients. Please be kind to the staff there who are working as fast as they can. We will have more confidence in the advice we can provide the government around alert levels if we have good testing rates. So if you have symptoms, please get tested. There's a lot of contact tracing work happening across Auckland and the Coromandel, and that involves the Auckland Regional Public Health Service, our National Investigation and Tracing Centre, and all of the country's public health units. Isolation by close contacts when in alert level 4 requires them to isolate separate from other household members, so it's not isolating within the household bubble. As of this morning, more than 360 individual contacts have been identified. This does exclude at this stage contacts from large settings like Avondale College and the Central Auckland Church of Christ, where there's still an assessment underway. So through the day today, that number will increase significantly. Now, details of additional locations of interest continue to be added to the Ministry's website this morning. We're also going to put out regular through-the-day updates on newly emergent sites of interest, locations of interest through our various social media channels to make sure that it's easy for people to see just which are the new ones. And it's very important that people look at the times as well as the place, because it doesn't mean if you had been at those places at any time. Please look at the time there. If people have been at a location of interest, remember the form is to isolate if you are not already. In other words, if you're not an essential worker, it does mean if you can't go out to the supermarket, pharmacy or anywhere else while you're doing that, while you're isolating, call Healthline for advice. Busiest day for Healthline yesterday since April last year, and a record number of people accessing the Ministry of Health website, almost 1.3 million, largely looking for locations of interest. On that, just a reminder, there is a Section 70 notice in place which requires everybody who has been at a location of interest to legally follow public health instructions to isolate and be tested. There is a separate Section 70 notice that applies to the household contacts of a person who has been at a location of interest. Under that Section 70 notice, and this is a new thing, they are required to isolate as well, and this means they can't go out for any purpose, or if they're an essential worker, they need to isolate until that person who's been at a location of interest has returned a negative test after day 5. We are also receiving a large number of complaints about enforcement, particularly about people holding gatherings, and these are all being referred to police to follow up. Finally, it is a time of uncertainty, and so quite normal for people to be anxious. Please do keep an eye on each other. Last year, we crushed the curve by looking out for each other. Don't forget the smallest and largest question you can ask someone is, are you okay? Back to you, Prime Minister.
Thank you, Dr. Bloomfield. As you can see from that update, level 4 is where New Zealand needs to be at the moment. But as we talked about yesterday, we do want to ensure we don't waste any time in vaccinating Kiwis. I want to start by thanking New Zealanders for continuing to take up the invitation to book their vaccinations and remind everyone over the age of 40 that you don't actually need to wait for an invitation. You can go to the website or ring the 0800 number now to book yourself in. Yesterday was a record day for bookmyvaccine.nz, with 195,537 bookings made in a single day, which is fantastic. During yesterday's stand-up, the 1 p.m. update, more than 7,500 people per minute were using the site, and it performed exceptionally well. As signalled yesterday, a phased approach to reopening vaccination sites with the level 4 protocols in place has now begun. This enables everyone to stay safe while we vaccinate. So please, if you have a booking and you have not had any other communication from your provider, please still go, because we're expecting you. Primary care facilities have also resumed carrying out COVID-19 vaccinations today, and with some less urgent appointments being cancelled as a result of level 4, many now have extra capacity. Our plan is to use that extra capacity to continue with those who are already booked in, but to also bring through essential workers. Our plans to vaccinate these workers starts with those who are customer-facing, who interact with the public as part of their essential work. For example, supermarket workers who may not have been eligible because of their age bans to date. We're working with employers of these essential workforces to identify the individuals, and workers you can expect to hear from your employer with extra details. We're also working with the COVID vaccination Healthline on a process for smaller businesses and people who are self-employed to enable them to book if they too fit that criteria. On that note, I also want to assure New Zealanders that our vaccine supply chain continues to operate well, with the deliveries continuing to go out daily. But again, please do book. It just means that we can ensure good physical distancing when you attend your vaccination appointment. As you know, it's imperative that we get as many people as possible vaccinated. When we make a decision on who is eligible, though, our number one priority is the medical advice of our experts. You'll remember that in June, our regulator, MedSafe, granted provisional approval for the Pfizer vaccine to be given to 12 to 15-year-olds in New Zealand. Similar decisions have been made by other regulators in Europe, the US, Canada, and Japan. The advice was then considered by an additional group of experts who also supported an extension of eligibility to young people. On that basis, Cabinet has agreed to make the Pfizer vaccine available for 12 to 15-year-olds. This is not a decision we have taken lightly. Many of us are parents ourselves and take this duty of making decisions about other people's children extremely seriously. But it is safe, and it's the right thing to do. So 12 to 15-year-olds can become eligible and book, along with everyone else that we are opening up to from the 1st of September. We know, though, that a number of these children's parents will already be eligible to book their vaccines. We want to be practical about this. So from tomorrow morning, parents and caregivers who are eligible for their vaccines will also be able to book their 12 to 15-year-olds at the same time. But if you've already booked, then just bring them along. Please just make sure that while you do that, you work hard to keep physical distancing up from others. There are an estimated 265,000 people in the 12 to 15-year-old age bracket, so this is an important next step. And please be assured again, we have more than enough Pfizer vaccines for everyone, including the 12 to 15-year-old age group.